Welcome and good evening. My name is Jan Riker, and I am the Vice President of the Board of Directors of the San Francisco-based Jewish Community Relations Council. JCRC, as we're known, builds relationships with other faith and ethnic groups and advocates and educates on pressing issues to the Jewish community. We represent over 50 Jewish organizations and synagogues across 7 counties in the Bay Area. I would like to start out by thanking our partner, Access Reproductive Justice, for working with us to put this event together and for joining us in the conversation this evening. I would also like to thank our co-sponsors, the National Jewish Council for Women San Francisco chapter, the Jewish Community Federation and Endowment Fund, the Jewish Community Federation of Sacramento, and the Jewish Community Federation of Silicon Valley, as well as Bend the Arc. Thank you. A Pew poll from 2014 showed that 83% of Jews nationwide believe that abortion should be legal in all or most cases. We know that the number is higher in California. In 2013, JCRC brought together our community for a consensus building process to determine JCRC's policy stance on abortion. We heard from people from across the broad spectrum of Jewish observance. Our statement reflects our beliefs in the value of human life, the right to privacy, religious freedom, individual choice, and equality. With such a high level of support in the Jewish community for abortion rights and access, we know the Jewish community of California can be a leader in this fight. That is why we are so excited to announce that we are one of 2 Jewish community organizations endorsing Proposition 1 to enshrine the right to an abortion in California's Constitution. Later, you will learn more about how you can join us in this effort, and we hope you will. With the overturning of Roe v. Wade and the tightening of abortion rights and access in states across the country, we in California are in the unique position of living in a state that is a leader in abortion rights and access. In fact, Governor Newsom has called for California to be a sanctuary state, and people nationwide are looking to California for leadership. Yet California is not perfect, and with people in need of abortion services coming in large numbers to California to receive care, some of California's shortcomings around access and affordability are coming into sharper focus. So how does California fulfill its promise as a beacon of hope and a national leader while also addressing our own internal issues? That is what we are here to discuss this evening. I will now hand it over to Jessica Trubowitch, JCRC's Director of Partnerships and Policy, to introduce our guests and kick off our conversation.
Thank you, Jan, and welcome everyone, and especially welcome to our guests, Assemblywoman Rebecca Bauer-Kahan and Xochitl Lopez-Ayala. It is really a pleasure to be speaking with both of you this evening. I want to start out by just sharing a brief bio for both of our guests. Assembly Member Rebecca Bauer-Kahan was elected in 2018 to serve the 16th Assembly District, that is right here in the Bay Area in the East Bay. Rebecca is an accomplished attorney, environmental advocate, community volunteer, law professor, and mother. A Bay Area native, she has dedicated her career and personal time to improving our community, solving complex problems, protecting civil rights, and fighting to ensure everyone has the opportunity to succeed. In her years serving as an Assembly member, Rebecca has introduced and advocated for legislation that addresses some of the most pressing needs of our communities and her constituents. Whether it be introducing legislation to protect abortion care and reproductive health, protecting our sensitive ecosystems, or working to promote gun safety and gun violence prevention, she ensures that our communities needs are addressed at the state level. Since joining the legislature, the governor has signed 16 of her bills into law. We at JCRC are privileged to call Rebecca a friend and to have worked closely with her in her role at the Jewish Legislative Caucus, and more recently as a member of JCRC's Bay Area Network of Jewish Officials. Xochitl is the Policy Advocacy Coordinator at Access Reproductive Justice. Xochitl was raised in the heart of Los Angeles in the San Gabriel Valley on occupied Tongva land by her hardworking parents. Her drive for adventure took her to Alaska for the last 14 years, where she has had her Clark Kent day job, I love that, of managing store sales operations for the largest telecommunications company in Alaska. Afterward, she channeled her Superman and has been involved in several volunteer roles to advocate for social, racial, and reproductive justice. She always advocates for affordable, safe, accessible, inclusive reproductive health services for all, and in the last 5 years, shifted from a reproductive rights to a reproductive justice mind frame. And I hope you'll share that with us, a little bit more about that in our discussion. She is currently on the board of the Northwest Abortion Access Fund, is the vice president of the board of directors at the Kachemak Bay Family Planning, and is a part of Homer Pride Planning Committee. She recently graduated from the Movement Makers Leadership Development Program from the National Network Abortion Funds, and joins fellow graduates in joining Access Reproductive Justice. She is supported by her spouse, Dawn, and their 2 lovable dogs, Leica and Charlie. Welcome to you both. We are so happy to be in allyship with both of you. So the format for this evening will be an interview style discussion, but I hope both of you will feel free to speak to answer either of the questions if you like. If there is time at the end of the discussion, we will move to a Q&A. Anyone who would like to ask a question, please go to the bottom of your screen and click on Q&A. The only questions we will answer this evening will be written ones that have been written in the Q&A section. So let's begin. I'm going to ask both speakers to open things up with your thoughts on the impact of the Supreme Court's decision to overturn Roe v. Wade. What has been the impact of this on your work and on abortion rights and access in California, and possibly more broadly across the nation? So let's start with Assemblywoman Rebecca Bauer-Kahan.
Well, thank you, Jessica, for having me here, for convening this conversation, and for your incredible work on abortion rights. I actually just spent the afternoon with Vice President Harris talking about abortion in San Francisco. I was with Xochitl's colleague who was at the table as well. And one of the things that we discussed was faith and how faith has to be a part of this conversation. And my sister, who's a rabbi, always talks about the role of Judaism and how it relates to her feelings on abortion. And I think it's such a critical intersection, and one that you guys really are at the front of. So thank you for that. So, you know, for anyone paying attention, and I know everybody on this webinar was, it wasn't a surprise when Roe v. Wade was overturned. The question was when, not if, I think, for many of us. When I joined the legislature in 2018, one of the first things I did was form the first of its kind in the nation Select Committee on Reproductive Health. And we did that in part to prepare for this moment. We knew it was coming. We knew that California wasn't providing reproductive justice, as you'll hear Xochitl talk about, for every Californian. Not everyone has access to comprehensive reproductive health care before Roe v. Wade was overturned in California. We have healthcare deserts. We have incredible numbers of maternal mortality. So we knew we had a long way to go to prepare for this moment when we would become a sanctuary, when we would become a place that people would have to travel to receive care. And so we started that work and the conversations around what that looked like to build up California's infrastructure. Last year, I carried a bill on security and safety at our clinics. So really focusing on how do we keep our patients and our providers safe. That was getting worse even before the fall of Roe. And then the Supreme Court went further than I expected. I didn't actually expect them to fully overturn Roe. I'm going to be frank with you. I was a little naive in that way, but here we are. And it, so I was doing the work before, but it has accelerated the work and the urgency of what we do. I have the privilege of carrying 2 bills right now that I know we'll talk about later, both of which focus on civil and criminal liability for those who access abortion, those who support people getting abortion, and our abortion providers. And in that work, I have the privilege of talking to our abortion providers regularly and hearing their fear of being prosecuted, of being brought to court for providing healthcare is real. And so we knew that not only do we have providers who will show up every day to provide this care, no matter who shows up at their doors, but it was our job to protect Californians, to protect our health providers, to protect those who support people accessing abortion, and truly become that sanctuary. And so we've been doing that work. We have not been doing it alone. About a year ago, the governor convened the Future of Abortion Council, which Xochitl's organization and many others were a part of, that really looked at what was the future of abortion in California. We knew that they had taken up, the cases that were going to overturn Roe, and what did we need to do? And they made recommendations to us in December. It was incredible work they did, coming together, talking to the people on the ground, and then telling us as legislators what support they needed from us, both fiscally, so in our budget, and through policy work. And then we have been working since January to make all of that a reality for everyone in California, but the work is far from done. And those who want to take away rights from women are going to keep us on our toes for a long time. And so we will continue to need to do this work and stand our ground, but it's through our partnership with all of you that we're able to do that. So thank you.
Xochitl, why don't you go ahead?
Thank you. Thank you, Jessica. And thank you, JCRC, for having me here today. As they had mentioned, my name is Xochitl Lopez-Ayala, and I use she, her pronouns. And I'm the Policy Advocacy Coordinator for California's only abortion fund since 1993, which is Access Reproductive Justice. We've been here because of community support and values in the reproductive justice lens. So to elaborate what we had mentioned earlier, reproductive justice, or RJ as it's commonly known, is defined by Sister Song as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. When using the term reproductive justice, we want to uplift the urgent need to address how race, class, gender identity, immigration status, disability, location, and all other levels of oppression impact our ability to make autonomous decisions about our reproductive bodies. So we strive to use reproductive justice lens in all our advocacy outreach. People contact abortion funds because we remain the expert when it comes to navigating the difficult terrain of trying to get an abortion. We've had decades of wisdom and experiencing assisting people over abortion barriers and with compassion and care. Many of us were already navigating abortion bans in other states and already navigating a post-Roe world with waiting periods, parental consent, lots of barriers in accessing abortion. Abortion access, crucial for liberation. We've been also very active in the Future of Abortion Council through a diverse coalition of stakeholders in helping to pass legislation with reproductive freedom partners like Assemblymember Bauer-Kahan, and I'm so honored to be on this panel with you. California is heading in the right direction, and we have been preparing for this. California has started enacting protections thanks to the Future of Abortion Council recommendations provided in 2021 to work through this current legislative session. I'll pass it back to you, Jessica.
Sorry about that. I clicked on the wrong thing there. So let's start out by talking about some of that legislation. Governor Gavin Newsom called California a sanctuary state for people seeking an abortion. And Assemblymember Bauer-Kahan, JCRC, was really proud to make your bill AB 1666 a top priority for us this session. Can you tell us a little bit about that bill AB 1666 and your newer bill 1242, and what was your motivation behind those bills and how are they doing moving forward?
Yeah, so AB 1666 came out of sort of my last fall, when we started to think about what would it mean for Roe to fall, and for people to come to California from states that did not want those women accessing abortion care, what would that mean for Californians and California? And immediately as an attorney, I thought about SB 8 in Texas and the civil liability that if Roe fell could then be in our courts, and our courts would have no ground on which to not enforce that law because Roe was no longer the law of the land. And so we started to think about how we really put up barriers from out-of-state laws like SB 8 in Texas, which fines providers and those who support patients. So organizations like Xochitl's can be fined for providing support to patients who are accessing abortion, and the patients themselves, although so far we haven't seen that piece of it, but nothing's off the table right now. And so, we worked with actually some incredible constitutional experts at both Berkeley Law and Stanford Law. Being Californian means having access to the greatest minds in the nation. And so we access them often on what we could do constitutionally to protect Californians. And so 1666 stops any out-of-state law that impacts abortion from being enforced in our courts. So if you show up in our courts with a case based on an out-of-state law, so for example, you've brought that case in Texas, you've gotten a fine against a Californian, and now you want to come enforce it here because that person's money is in California, our courts get to say, no, we don't have to hear that case, and it's done. And so that was the goal of 1666. And we were able to move that bill really in large part because of the incredible work of our constitutional experts that advised us very quickly. It was in such great shape in the Senate that it took no amendments in the Senate and went straight to the governor's desk and was signed the day that Roe fell. So that afternoon, we had just sent it to the governor the day before, that Thursday. And I called the governor's office and I said, it's on your desk. We need you to sign it before the day ends. And he was able to do so, which was incredible. And so it took a lot of partnership in the legislature to make that happen. But that is now the law of the land. It had an urgency clause, so it was signed and became law immediately. And we're incredibly proud that our courts are in a position to turn all of those cases away if they land in our borders. And then we continued to think about what it meant. And actually, AB 1242 came out of an incredible opportunity I've had to work with a working group in the White House. They've convened state legislators like Pro Tem Atkins and myself across the country who are working in this space to share ideas. And Connecticut went first in doing what is in 1242, which is stop the extradition of those who are providing abortions. So if the abortion is provided here in California, it is legal. And so we do not have to extradite people who are lawfully acting within our state borders. And so we will not extradite those individuals for criminal prosecution out of state is what that says. And it also provides privacy protection so that our law enforcement will not be enforcing any subpoenas or warrants for abortion cases. So continuing to look at how we can protect within our borders, which is so critical to ensuring that our providers keep providing abortions and people can come here to access that care. And Californians feel safe in doing so. So that's a little bit of what we've been working on. As you heard, or I don't know if I mentioned it, but it's a package of now 16 bills are moving through the legislature, and this is just 2 of them. It is an incredible body of work. Prop 1 is one of them. We were able to put that on the ballot. And it's an incredible body of work that the Women's Caucus has been leading to really turn California into a beacon. And we have sent our ideas to other states, and we are accepting their ideas as well.
I really applaud that work. And I wonder, just to clarify on 1242, if a provider came from out of state, could they, and were licensed here, could they provide an abortion and then?
So if the abortion is provided in California, we would not extradite them. Now, if they were to flee extradition, meaning the abortion was provided out of state and they did it in a state in which it was criminal and then fled to our state, the constitutional law is very clear that we have to extradite those individuals if they're fleeing justice. But because the acts happened here in the case of a physician from any state providing an abortion in our state, there was no criminal act that occurred and they didn't flee justice, we have a right to protect them.
Wow, amazing. Xochitl, I'm really curious. I know you have a large base of volunteers that are out there and a large group of providers that you work with. What are you hearing about what's happening really on the ground in California right now? What are kind of the greatest needs that you're seeing? And if you could share, what your volunteers are doing to help people who need to access abortion services. I think we'd be really interested to know more about that work.
Yes, thank you. So as you can imagine, we've been pretty busy. We have people needing and seeking our help in general, both from outside of the state and within the state as well. The best way to kind of describe it is like a wave. So there's a wave of need that folks want to give, and there's a wave of need that we need to receive in terms of like abortion access. So right now, we really need folks to sign up for reproductive justice information, as well as like trying to become an advocate or an activist. There's a wave of just reproductive information just washing over California. And in the 6 weeks since the Supreme Court verdict came down, we have seen record-breaking amounts of folks contacting us at our health line. And then for those who don't know, we offer a bilingual health line in English and Spanish, Monday through Thursday, where folks can call us and get assistance with their abortion, as well as if they need a ride or a ticket, bus, plane to their appointments. And I know that many folks want to be involved and help pick up folks at the clinic or have housing and volunteering in this practical support role. And we've seen an overwhelming amount of love and appreciation from you all. And we've actually reached our capacity for our practical support volunteers. And so right now we want to channel those folks who want to be on the ground with us in more of our activist advocate opportunities. So for instance, the bills that are going through legislative, like contacting your local officials that you support this, researching the California Future of Abortion Council bills, being involved in your local and state municipalities, just being out there and getting to know that like, that's gonna really change what makes California a reproductive freedom state.
Thank you for that. And so, Rebecca, going back to you, we have this great group of bills going through. The state seems to be going in the right direction. What concerns are still on your mind? And one concern I think that people are curious about is, how is California going to pay for some of these services to people coming in from out of state?
Yeah, it's a great question. So, I feel really, it's funny. We were talking this afternoon about how, in many states around the nation where the vice president has been, there's not a lot of, it's kind of hard, right? But here we have so much optimism because we know the work we're doing is right. We're in a community that supports us, although that's true across the country, as Kansas proved a week ago. I have the privilege of working in a legislature that I am optimistic will soon be half women. Gail Pellerin, who is hopefully going to join us from Santa Cruz, is on, but we are trying to get to 50% women, but we're at 30-ish% of amazing women who really do support this work, and the men who are our incredible allies. And the budget is a place where we do act. Now, I noticed a question in the chat about this. People have been very curious about how our funding is working. One of the things I really want everyone to understand is that we expect a 3,000% increase in the number of people showing up to access abortions. That's an incredible amount of demand on our healthcare providers. So imagine you're a Californian and you need prenatal care, right? Not even an abortion, you need OBGYN services, right? The same people who provide abortion care also provide prenatal care and other postnatal care, et cetera. And now we have a 3,000% increase in the number of people getting abortions. That's going to take a toll on our healthcare system, right? So the infrastructure we're building in California is going to help Californians. If we don't do that, we're not going to be able to support the people here that need our care, right? And we know that our providers are incredible and will not turn anyone away, right? So we need to build an infrastructure that supports every single person who shows up. And a lot of that is to help our Californians. And again, as I mentioned in my opening, we are not providing care adequately to every Californian today. We have healthcare deserts, and we have providers trying to meet that. Telehealth has been a game changer for many access issues, but we have a ways to go. And so part of the infrastructure we're building will help those Californians who, have not had good access to reproductive health care. My colleague up in Northern California who lives in Shasta talks about how there is one person within a 6-hour radius who can do a rape kit. So if you are raped, you have to wait in the clothes that you were wearing for hours and hours to see that one provider, right? So we are failing a lot of Californians today, and then we're expecting an influx, right? So that's part of what we're really looking at, is building up our infrastructure. The federal government is looking at, to the best of their ability, covering this with Medicare, which is really amazing. So the Hyde Amendment does put some restrictions on it, but within the Hyde Amendment, they can cover abortion care for where the life of the mother is at risk. So that is, some of the abortion care that's provided, and rape and incest, right? So there is some ability within the Hyde Amendment for the federal government to support us. And then we are trying to support patients as well. But it is really important. And we will, depend on organizations like Access Reproductive Justice to fill the gaps where the state isn't able to meet the need of those out-of-state individuals. And we're doing our best to be a partner in that, but there are limits on our ability. And so it's going to take all of the resources at our disposal to really meet the need of every woman that needs it. Oh, and one thing we're funding that's really cool, you guys, is a portal. So one of the things that we're learning is that even within states like ours, this confusion about the state of the law, right? The patchwork of laws on abortion across the country right now are so confusing, right? I mean, I am an attorney and I couldn't tell you where you can get what abortion in America right now, right? And so we know there's going to be room for disinformation and misinformation. So we're actually setting up a portal for accurate information. And that's the kind of thing we want to be supporting, right? Knowing how to access healthcare is critical to Californians and to everybody. And so having that portal from a trusted source is really important. So those are the kind of things we're working on.
So to hearing all this from the Assembly member, do you have other ideas about what needs to happen to make sure that people who are coming into the state and Californians themselves have the access they need? Do you have a certain set of things that you're advocating for that you think could help this situation?
I do, thank you. I also kind of want to first tag on to the tax dollars in California. And I wanted to just kind of reassure folks that that money is being spent here in California. So they're being seen by California providers that employs Californians. If we put folks up at hotels, they are employed by Californians. Sorry, my coworker is barking. And so what that does is it's also providing for increased wages to folks. It is also having to provide for the folks that are already in this work and doing the things that we can utilize. So we're not using another, out-of-state people aren't just coming here to take our tax dollars. They're essentially utilizing our tax dollars to help support other Californians. And so it's a really great reminder that they are also stimulating the economy. And as far as what else is needed, well, besides advocates and volunteers, just sharing information with your friends and family, your neighbors, the importance of registering to vote, where your local voting centers are ahead of time. We are also going to start at Access hosting advocate activist workshops this fall. And so we'll provide that information for you all after this. And as well as, getting the message out that we need to show up in record-breaking numbers to make sure that Proposition 1 on the fall ballot just kind of enshrines our protection to abortion access. So thanks for letting me answer that too.
Can I add one thing that Xochitl touched on that I think is really important, which is everyone on this call who is, and I believe you probably all are, people who believe deeply that the right to abortion access is critical, needs to start paying attention to that at every level of government. And I think this is what the anti-choice movement has been doing for a long time, which is electing people up and down the ballot that want to take this right away from us. And we have not been paying as much attention to who's sitting on our school boards and in our city councils. And those people not only may be your future congressperson, let's be clear, that's how this all works, but also there are issues even at that level of government that really relate to access to reproductive health care. Right. And so, I think it's really important. Walnut Creek, where I represent, passed unanimously a buffer zone around our Planned Parenthood, bipartisan, right? Amazing work at the city council level. Our school boards are the ones who decide whether our youth are going to understand their bodies and how they get pregnant. And so these are really important things to pay attention to and to really ask the question and make sure you're deciding accordingly if it matters to you.
Thanks for that. And Xochitl mentioned Prop 1, so I want to go there for a second. We have, even with all the concerns that we're talking about, we do have, California is an amazing state as far as abortion rights and access compared to so many other states. So we're supporting Prop 1. I know that both of you are either supporting Prop 1 as an individual or as an organization. But what do you think? What do you think the importance of putting abortion as a constitutional right is? Why is this so important to California when we have so many amazing other laws protecting abortion rights? Rebecca, why don't you start?
Well, first, I want to say that a month ago, I would have said, the contraception part is nice, but who's going to take away our right to contraception? And then we saw the vote in Congress where there was a very large number of Congress people who did not feel the need to protect contraception. And I actually, to be frank with you again, naivete on my part, was shocked by the numbers on that vote. But it tells us something, which is that, depending on who's in power, our right to contraception is at risk. That is something I don't think a year ago, if you would have asked me, I would have said was possible, but it's possible and we're seeing it happen. And so I do think the fact we don't have the right to contraception, I don't believe, although maybe I'm wrong, enshrined currently in the Constitution, and that is in the proposition and is important because it turns out that's a risk, which is crazy, but true. So people pay attention. So that's really important, but also currently, right, we saw what the Supreme Court said about the right to privacy and how little respect it got from the courts, and that's currently how our right to abortion is enshrined in our Constitution. And so what we really believe is that we don't want it to be enshrined in what is not viewed anymore as a strong constitutional right, the right to privacy. So that the right to abortion is in and of itself fundamental and its own right, the right to free speech, the right to, free expression of religion, and the right to abortion, right? These are all your constitutional rights, and the right to contraception. So, I think the way we enshrine our Constitution is really, really critical, and that change is going to have a huge impact on the future of California, given what could happen. We don't know what's going to happen, but given what is possible these days.
Yeah, and I'll also add on to that Prop 1 will basically amend the state constitution to explicitly prohibit the state from denying or interfering with personal choices, like regardless who's in office. And so it's really important that, folks are protected regardless of who's in office, that they can always refer back to the California state constitution.
So let's talk nationally now. Do you feel that California has the ability to influence the direction our nation is going on the issue of abortion? And do we have the capacity to really be a leader on this at this point? Xochitl, what do you think?
Well, we do actually. So as part of the California Future of Abortion Council, a lot of other states have already contacted the steering committee of that council, which is about 7 major organizations that meet weekly versus the whole coalition that meets quarterly. And so what other states have done is they have contacted us, like, how did you do this? How is this working? And just trying to solidify all the recommendations that we have and how do they implement that in their state. So most of the West Coast is protected, like as far as Washington and Oregon in their abortion access. And then you have a lot of, if and when and up in the air, and then you'll have like a few spots throughout the state. There's actually a really great map that I will send, and it's called What If Roe Fell? Obviously it did. And it shows you the highlight of like how all the states look and abortion access. And we've learned in abortion funding is that when they come for one, they come for us all. So what I mean by that is you have intersecting movements that will be disadvantaged by all of this. And so you'll see states with higher LGBTQ infringements, voting rights infringements, immigrant infringements. Those are all also states that have abortion access very restricted. And so we feel very confident in like the California side that we're doing a great job. And just knowing that like it's a web of issues. And just like I said earlier with the wave, there's a lot in those waves. There's LGBTQ issues, housing security, food access. And so we can't just be singular in how we think about reproductive health, because your housing can affect how you raise your family. Your food security can affect how you raise your family. And so those are all things to just kind of think about also.
That's really interesting. And are you seeing other movements step into the space of reproductive justice and act as an ally at this point?
Yes. So a lot of the movements have already been doing the work. So like we don't need an auntie network, we don't need an underground railroad, and using terms like that actually undermines a lot of the work that Black and Brown folks have already done in this work, as well as LGBTQ folks, in making sure that folks have these mutual aid efforts, these access to housing, food, immigration rights. And so in that's what it's been really crucial to see, that like now these organizations are being uplifted.
That's how you build a really strong movement. Rebecca, what do you think about California as a national leader? What are you seeing?
We absolutely are. So the Future Abortion Council, which we both mentioned, has only happened here in California. And it really is a model that other states are trying to follow, because there is nothing like being informed from the people doing the work, representing our many diverse communities. And the FAB Council was made up of, an incredible group of diverse organizations that are working with the diversity of California. And it really made our work that much more powerful and directed. And in my time in the legislature, it's not been that long, but my colleagues who are on longer say the same thing, that they've never seen a package this sharp, this effective, this successful move through the legislature as quickly as we have. And that was informed by the incredible work of the FAB Council. And so I do think that was us immediately showing leadership of what it means to build coalition, to listen to the people who are doing the work, and then act. And that is what California has done. And then I think, like I said, we are sharing ideas across state lines. We know that we have to. I just learned we had a law that was overturned by the Supreme Court years ago, and we haven't gone back to that topic because we thought it was off limits. And I learned, by working with legislators in the state, that they tried it a different way and it hasn't been overturned. And now we're going to go back to that and try to do it, do it the way that Connecticut did it, because it worked, and that's just from my relationships that I built with these legislators who are leading in other states. So we're leading, they're leading, and it's really, I think it's more about collaboration than it is one state sort of saying we're the ones, because it is going to take all of us that are willing to do this together to provide the safety net that women and pregnant people need. And part of that is, as Xochitl mentioned, the map, right? So we're in this beautiful West Coast where there's lots of access, right? But if you look at, Illinois is going to become really important because a lot of the states around Illinois don't have access, right? And so New Mexico, right? Because you have people coming from Texas to New Mexico. And so how do we provide the support for the other states, given geographically what's happening in America? Although I have to say, Kansas gives me optimism that if we leave it up to the voters, the map will look very different.
So
also
I'm
like
gonna,
to-
oh, go ahead. So
I'd also like to say that like it's not all doom and gloom, and that often a lot of us have been in this like shocked mind frame like the last 6 weeks. And to show you that like California has already been ready for this is in 2019 there was a bill that was passed to where students for UC and Cal States will be able to have access to the abortion pill on campuses starting in January. So that was already something that was already taking precautions into becoming a sanctuary state, as well as SB 245 was signed earlier this year that prohibits health plans and insurers from imposing a copay, deductible, or other cost sharing requirements for abortion or abortion related services. So that's all starting in January, but that took long-term planning of already seeing the barriers that other states were going through. And so I just wanted to, not it's not all, sometimes you have to go through the clouds to see the rainbows.
I
And
appreciate
that touches on a question I saw in the Q&A, by the way. Someone asked about insurance. And yes, although insurance is available, we do see that abortion care is, it disproportionately impacts some of our low-income communities, right? So, it is important that we have safety nets as well when it comes to this care and make sure that everybody can afford it.
So, Xochitl, maybe we could also just share with people what are some of the biggest barriers, cost being one of them. What are some of the barriers for people to access abortions in California? And then I want to move to the Q&A because I do see that people are asking lots of questions and I want to make sure we get to as many as possible. So Xochitl, maybe share some of those barriers just so we can get a greater understanding of what people are facing when they seek an abortion, and then we can move to some of these questions.
Yes, thank you. So the average cost of an abortion in California for a non-insured individual for medication abortion runs around $737. And a surgical abortion, the average cost is just under $1,000. So if you are living kind of paycheck to paycheck, or you just have other barriers to getting that money, obviously you're going to have a little bit more of folks that have access to money easier, be able to afford that easier. And that's where folks contact us as Abortion Fund. That's how they usually hear about us, is through the clinic. And in going through, like, I didn't know how much an abortion cost until like several years ago. And I don't know what I thought, that they were free. So it's like, this education of learning that just because something is legal and protected doesn't always mean that it's accessible. And so if you're encountering barriers in like, I don't have a car, how am I going to get to my nearest clinic that might not be able to help me without several days turnaround because I need to get money? And then I'm traveling, I'm taking time off of work. And so there can be a multitude of barriers. And that's not saying that everyone has a barrier. There are folks who have more than one, and that's just something to acknowledge. And to kind of give into perspective of what we do at Access is our average Healthline caller is pledged up to $250 that we send to the clinic, and we average around $300 to $1,000 like for an average grant. And we set aside $20,000 each month and about $5,000 per week. And every week we run out, we have to contact people. We also work with other abortion funds in other states if they're able to do solidarity pledging, because we have seen that some folks who, if they're in an area that doesn't have an abortion clinic, we found that pushes them out later on into their term date. And so their gestational age means they now have to travel. So they travel to Seattle, they travel, maybe they're in LA, and they have to travel to a different clinic that might not be closer to them. So those are all just kind of barriers.
Yes, thanks for sharing that. And I'm going to move and start reading some of these questions because there's some really good questions. So I'm kind of scrolling through the list, and the first one is about Prop 1, and either of you feel free to answer. But basically, it's just how can local organizations ensure that Prop 1 passes? What is being done or can be done to ensure voters are going to vote on this critical midterm election? Xochitl, do you want to start, or Rebecca? Either one, go ahead.
I guess I'll give my quick one of what like employers can do to help is give your employees time off to go and vote. Encourage them to do it on the clock so they're getting paid, so they're not taking time away from work. Having that early voting as well, if you're able to do that on the clock and make sure you get paid, and just kind of encourage them to do that, because a lot of folks don't want to take time off from work because they'll get in trouble or have something held against them. And so it's important that they're able to kind of utilize that employer that wants to help this into getting that done by voting.
And I'll just note that in a few minutes, my colleague is going to talk about JCRC's work on Prop 1. So I'm not going to say anything about what we're doing, but so I don't ruin her points. But we do have some campaign plans, and look forward to sharing those. So I'll move to the next question, and this one is for you, Rebecca. There's a question about federal dollars for infrastructure, and if it's going to come from I think it's the infrastructure for abortion services to come from Medicare or Medicaid. Is there something coming from the federal government?
So most of the infrastructure we're building here is coming from state dollars.
Okay.
But again, that's public health infrastructure that's utilized for all sorts of things, whether it be STDs, prenatal care, abortion care. I know my local Planned Parenthood provides abortions just 2 mornings a week, and they're open 5 days a week, 9 to 5, right? So when we're building reproductive health infrastructure, it's providing incredible array of care, but that includes abortion care. Their hours will probably go up with the influx, but for now, that's what they see. But I want to add one thing to the Prop 1 thing, which is obviously tell everyone to vote, talk about it. But I saw a question, which I don't know if we want to get to, but about misinformation. And I think this campaign will be ripe with misinformation. So I think the role that each of you can play that's really critical is to understand it as well as you can, and to be able to talk to those points and make sure people understand what this is about. Because fundamentally, what this is about is the right to make the decision to have an abortion or access contraception with your partner, your provider, your faith leader, whoever it is you consult, but not the government. It's not about us dictating who has access to abortion and who has access to contraception. It is about people making that decision, whether they do or not, right? Many people will choose not to have an abortion, and that's a perfectly wonderful choice as well. But that choice should not be dictated by the government. And that is what this is fundamentally about, and what we need people to understand.
So there's a question about Prop 1 and what it will allow. So someone asks, my understanding is a person in California cannot get an abortion after the fetus is viable. Will Prop 1 change that?
So people are surprised to learn that we actually send people to New Mexico to get abortions. They actually have more permissive abortion laws in California. It's obvious, that's often shocking to people, but it's true. And so that's law. That's legislation that has been passed that states when abortion can be accessed in California. The proposition, which I actually kind of just want to read. Do you mind? Because it's one sentence.
Go ahead. Go ahead.
All it says, so everybody knows, is the state shall not deny or interfere with an individual's reproductive freedom in their most intimate decisions, which includes their fundamental right to choose to have an abortion and their fundamental right to choose or refuse contraception. That's it, guys. That's the amendment. So it is very simple. And I want people to understand, I think this is really, really important, that when the Constitution says you have a right to free speech, that's all it says, right? It doesn't talk more about free speech, just says you have a right to free speech. There are tons of laws that talk about how that happens, right? You can't, hate speech is illegal, right? So we say, no, you can't do that kind of speech. We have time, place, and manner restrictions, right? You can't just go and interrupt a highway to speak. That's not allowed, right? So the legislature still has the ability to pass laws around something that is a fundamental constitutional right. And the same, there's no difference here, right? So it's a constitutional right, and that will be protected by the courts, and the law will still be true, right? So those two things are not inherently in contrast, just like they aren't in the First Amendment. I hope that made sense.
That did, and that's really important. And I think talking about misinformation, it will be important to keep going back to the language of the proposition as we move forward in the election, because there will be misinformation and question about what it really means. And so just going back to that language makes it very clear what it, what it does, what it's saying, and what it will do. So there's a question about, could this provision be challenged at the Supreme Court level?
Not the federal Supreme Court.
Okay.
It is the state Supreme Court that would oversee our state laws. And now if they were in contrast with a federal constitutional provision, then the federal constitution trumps the state constitution. But since the court has decided the federal constitution doesn't speak to the issue, that's what they said in Dobbs, then no.
Another question, I've heard that there is a significant shortage of medical professionals who have been trained in abortion procedures nationwide. Is there any push to have California medical schools focus on training more doctors or even midwives and nurse practitioners in safe abortion procedures? Xochitl, are you aware of any, or Rebecca?
So we have this funny thing that constitutionally we are not allowed to dictate what the UCs do. And I didn't know that until I got to legislature, and very few people know that. So we cannot tell the UCs to teach things or not teach things, or to spend their money one or another way. We can withhold money, that's our power over them, but that's it. Now that's not true for the CSUs, which is weird. So we can dictate what the CSUs do, but not what the UCs do. So that's a little bit of a thing, but the voting body of the UCs can. And I think it's an important question, because we know that providers are not learning this skill as much as we need them to, but so we are doing a lot of work on pipeline building. And one of the bills pending in the 16 bill package is a scope of practice bill, which actually allows nurse practitioners and midwives to expand their scope of practice. So we have more providers who are able to provide some of these services, not all of them. Some of them, need to be provided by an MD, but ensuring that each of those categories can provide abortion care within what is safe for them to do. And so that's one way that we're really making sure we expand care, and we want to make sure those people are trained as well. And then there's money to train, to make sure that we're training also culturally competent individuals. One of the things that some of the research has showed is that our maternal mortality rates in Black women are impacted by having a physician who is, understands cultural competency. And so we've done laws around that, but also getting more people into our care system that look like their patients is really critical. So that's part of what we're trying to do.
I would also add that there are several qualified individuals that are able to perform abortion-related services, like, for instance, distribute a pill for a self-managed abortion. However, restrictions have it to where it has to be done in a clinic, in an office with a doctor. And so there's all these little barriers inside of that. And the Future of Abortion Council actually addressed several of those. So fingers crossed, more folks will be able to provide better healthcare to everyone.
So there's one question here that I just want to speak to quickly, and then I want to give each of you a few minutes to make some closing remarks about what you see coming in the future and anything else you'd like to share with this group this evening. There's a question about how to get information about the legislation, and JCRC, we'll send out a follow-up email, and we'll make sure to link to a list of those those bills, so your advocacy group can follow up and support those at the state level. And so now let me turn it to you, Xochitl, just for some final thoughts.
Thanks for your patience. I was looking at all those awesome questions in the chat. Those are some great ones. Thank you all for that. So part of my closing, I guess, remarks. First off, thank you for letting me be in community and space with you all tonight. And where do we go from here? So first off, I want to highlight that we need to break down abortion stigma. And how we can do that is just by saying the word abortion. So a function of abortion stigma encourages people to believe that abortion is a bad word and it needs to be concealed. But we only liberate abortion from stigma and shame by saying the word abortion. Safe, legal, rare, it's stigmatizing, and it contends that abortion is not something that should be happening, thus it should be rare and reduced. However, there will be as many abortions as there needs to be, and we can only destigmatize abortion by saying the word abortion. Second, if you feel comfortable, share your abortion story. We hope that by sharing your story, you can work to dismantle the stigma in our communities surrounding abortion. And I've learned that in just saying the word abortion around folks, that several folks have come to me and been like, thank you for letting me talk about my abortion with you. I just didn't tell anybody I had one, and thank you. And so by opening it up, by saying those words, you make folks feel comfortable. And we hope that that will also help you in supporting your friends, your family, your loved ones who've had an abortion by acknowledging their love and being an advocate and, helping to pass legislation and contact your elected officials. And if you think that you don't have a voice, I would like to remind you like what the folks in Kansas did in accomplishing and striking down an abortion ban, as well as locally, San Clemente tried to enact an abortion ban and folks came out and no, we're not going to do that at the city council meeting. And it was shot down. So with that, I give you that you are very powerful. And then finally, I want to acknowledge that like our practical support volunteer role is kind of full. So I will be getting in touch with several of you about an activist advocate opportunity. And I'd like to remind folks that please do not fill up our helpline with voicemails or inquiries of applications if you have sent them. We are a small team of 6, and there was over 6,000 applications that were submitted from the leak in May through the decision. So the weeks after the decision. So please be patient. And yes, thank you all for allowing me to be here. And I am happy to talk about abortion funds and abortion funding all day long. So I'll pass it over to Assemblymember.
So I have to say that one of my favorite parts about Judaism is the notion of tikkun olam. And right now the world feels really, really broken, feels really shattered. And there's no question about that. And I do this work every day. So I live in the shattered world, but I also get to work alongside people like Xochitl who do this work all day, every day. I get to talk to the providers who tell me, I don't care if someone tries to jail me, these women need me, these girls need me. And I'm going to be there because I know what it'll do to their life if they don't have an abortion. And so there is so much hope, but I truly, truly believe, as I was taught, and I think I saw one of my Sunday school teachers on, that together we can repair the world, that I can't do it alone and Xochitl can't do it alone, but if each of us does our part, we can heal it. We can, and we are on that trajectory. And I think we've hit our turning point. And each of you showing up tonight tells me we've hit that turning point. And so thank you for being here, for being in this fight with us. We will each do this differently. Not all of you are going to become legislators who, work day and night on policy and dorky amendments to make sure we've covered every possible person before August 31st. But, and not all of you will be working in an abortion fund, but you each will do your part. And that is what is going to heal us and what is going to protect the rights of women across this country and the LGBTQ+ community and people of color, because as Xochitl said, they aren't just coming for the rights of the women, right? As we know, this is just the beginning. So, so thank you. And I'll close by, I thought I didn't have an abortion story because I never had an abortion. And then I was going to speak at a Planned Parenthood event, and I realized I did. And it was the moment that my doctor talked to me about whether or not I would keep. I had a very complicated pregnancy. I had to be medicated. I had appendicitis while pregnant, which I don't recommend, and then got a horrible infection, and they had to save my life. And in the course of that, didn't know what had happened to the fetus. And my doctor sat with me and she said, we have choices. Do you want to talk about those choices? And we talked about them, and I decided to carry the pregnancy to term, and it was respectful, and it was with me and my husband and my doctor. And it didn't feel like a story, right? It just felt like a moment that I made a medical decision. And that is what I want for every American woman, is for it not to feel like a story, because that is a story, right? But it's one filled with respect and dignity and choice. And so those stories need to be told too, because my story is what it was because I'm a white woman of privilege in a state that protects me. And so let's get that story for every single person, no matter what their race, no matter where they live, no matter what language they speak. Let's make sure they have a right to the dignity that I had. Thank you.
Well, I gotta say that both of you have me a little choked up and feeling very hopeful and motivated also. So I want to thank both of you for your time this evening, for your energy, for all your hard work that you're doing for all of us in California. And at this point, I'm going to turn it over to my colleague, Julia Abramson, who's going to talk about how people can engage with our Prop 1 campaign, which is connected to the broader campaign and which I am really excited about. And so, Julia, why don't you share with people how they can get involved?
Yeah, thank you, Jessica. So thank you so much to Assemblymember Bauer-Kahan and Xochitl for the informative Q&A. And thank you to everyone for coming tonight. Like our speakers and so many of you, JCRC wants to see California fulfill its promise as a leader for abortion rights and access. And this is why we're really excited to kick off JCRC's campaign to support Prop 1 tonight with all of you. So JCRC is working with the Prop 1 campaign as a Jewish leading voice in this fight, and we invite all of you to join us. So there are some ways to get involved with JCRC's campaign. That includes virtual volunteering, such as text banking, phone calls, postcard writing, in-person volunteering, so canvassing, passing out literature, signing up for JCRC's listserv and keeping updated with our campaign, and signing up for future webinars involving Prop 1 and beyond. So after this program, you'll receive an email with a form that will give you options on how you would like to support our campaign, along with how to support access and links that they share. Once you've submitted the form, we'll be in touch with you to let you know about upcoming opportunities to participate.
Thank you. I want to thank our staff, Jessica, and 1 second, focus. Jessica and Julia and Carlos, and we have other staff that are joining us tonight. I want to thank them for all their work and all their support. And I want to thank everybody for being here. Rebecca and Xochitl, you are so inspiring, and I hope that everybody was inspired by tonight. And we hope that you have a wonderful evening. Please fill out your survey, and we look forward to continued efforts in this area. We hope that you'll help us, and we'll see you soon. Thank you.